Well, tomorrow marks the end of American Heart Month, and a new study from Northwestern Medicine shows that men's heart attack risk climbs significantly after they hit age 30, years before women see that same risk. So joining us now to break down the study and what it means for us is Dr. Huseng Vefali, who's a cardiologist at St. David's South Austin Medical Center. Dr. Vefali, thanks for being here with us.
Thank you for having me, Mark.
So first things first, can you just talk a little bit about this study and what it means for men over 30?
Absolutely. This is a study that's been going on since 1985. So they've collected data on about 5,000 patients. Half of them were male, the other half were female, and they had African American and white patients. And they looked at incidence of cardiovascular disease onset, meaning what time did heart attacks occur, coronary artery disease or plaque buildup in the blood vessels occurred, heart failure or stroke. And the way they did that was annual follow-ups with patients, phone calls, and testing that they did. And they found that although we knew this data from before, but heart disease affects men at significantly higher rates than women. And now we see that it affects men at a much earlier age than we previously thought.
Right, 30 years. I mean, that's really, you have to really be attuned to it. So stress is a big factor in this. And a lot of people tend to misdiagnose, misread the signs. So what are some of the signs of stress that men should be watching out for?
Absolutely. In this day and age, stress is everywhere, from household to workplace to just general world events. There's a lot of stress that affects men and women. It really is hard to catch because a lot of times the signs of stress are not very evident. One of the main factors that need to be monitored is blood pressure, because stress affects blood pressure significantly. Monitoring blood pressure is recommended at patients that are at high risk, and usually an initial screening is recommended at the age of 20, but longitudinal monitoring is very important.
I know that when I go to a checkup, when I get my blood pressure taken, I always ask the nurse, is that good or bad? You know, and it's good to know where that stands. Family history is a big part of this, and a lot of people don't know their family history. So how can they go about finding out those details to see if this is in their genealogy?
Absolutely. So certainly getting firsthand information from relatives would be very helpful. But in cases where that is not possible, there are certain biomarkers that will reveal information regarding somebody's genetic makeup that would increase their risk for cardiovascular disease. Some of those are very simple blood tests, lipoprotein a, apoprotein B. These are markers that we look at to identify somebody's genetic risk and current risk of circulating cholesterol particles that are likely to cause blockages in the blood vessels. And certainly the regular cholesterol panel with LDL monitoring and HDL monitoring will be very, very helpful.
Okay. And so very quickly, a place to go check, where can people get more information about it?
Your primary care physician obviously is a very good resource for that. At St. David's Medical Center, at South Austin Medical Center, we have a very robust cardiovascular program, and we are very happy to take care of the community, both with education and with their acute needs.
Dr. Vefali, thanks for the tips. Good to see you.
Thank you.
Yeah.